From CBS 4 News, this is Facing South Florida with Jim DeFede.
Good morning, I'm Jim DeFede and welcome to Facing South Florida. With the United States reaching the grim milestone of more than 3,000 people dying in a single day from the coronavirus, this is indeed the dark winter that scientists predicted, but that President Trump blithely ignores. But there is some hope. The United Kingdom and Canada have begun vaccinating people, and the United States will likely begin as soon as next week. It will take time, probably 6 months, maybe more, to get enough of it out there. The most vulnerable, as well as frontline healthcare workers, will be the first to be offered the shot. A survey of nearly 6,000 Jackson healthcare workers found that just under half said they would be willing to take the vaccine in the first round. Another 36% said they would consider taking it in a later round, and almost 15% said they were not interested at all. These numbers include not only healthcare workers, but all employees at Jackson. Dr. Peter Paige is the Chief Medical Officer for Jackson, and I asked him what he thought about the results of the survey.
We were very happy with that number of people responding to the survey. I understand a certain amount of hesitancy, but we're very excited that almost half of those that responded, are ready to take the vaccine. I think that's a very positive sign. The second group that you had mentioned, the 36%, didn't say no. They just said they didn't want to participate in the first round and that they would consider it for future rounds. That's a huge response for us. That's an extremely positive response. We're taking a lot of positivity out of that going forward. As we kind of look at this as, the light is starting to shine at the end of the tunnel. It's been a long 9 months, and we think that people are appropriately responding to the opportunity to get vaccinated. And we think that there's going to be many more, both those that didn't respond to the survey and some of the ones who didn't respond that they were ready right now. I think there's going to be a fair amount of those that are also going to decide to join the first round.
Now, I did have a question. This was among all employees the survey was made available to, whether or not you were, for instance, a frontline physician, nurse, or whether or not you were someone who worked almost, let's refer to it as back of the house, whether it's in food services or other areas. Do you have any sort of a breakdown as to among those who are frontline medical workers, what their percentage was within the survey?
The only real caveat I can tell you is that a very high percentage of our health staff, our trainees, the residents and fellows, all have signed up to be part of the first tranche, so to speak, to be vaccinated. I don't have any numbers as it relates to employed physicians, nursing staff, or other staff at this point. But I think that we did get a pretty good positive frontline staff response as well.
And I know that there was a town hall meeting last week where Magoya and others sort of addressed some of the concerns or some of the questions. I'm not even sure there were many concerns raised during the town hall. So how much of this is an education campaign, both internally within Jackson and then to the larger public as well?
I think you're right on. I think an enormous amount of this is education. I think there's a lot of unknown, especially among a lot of our staff and a lot of the people in the communities. And I think that whenever you see these trials that were pretty well conducted that go through so quickly in an effort to try to help us get, past this pandemic, people get a little nervous. But I think when you really research it and look through a lot of the detail of the trials and you get opinions from a lot of the content experts, and we have some of the best and brightest clinicians in the nation between Jackson and the University of Miami, you feel a lot more comfortable and you feel a lot more reassured as you start getting more and more information and the communication and transparency around the vaccine and potential side effects and efficacy come out.
Well, let me ask you this. Let's just put the question to you bluntly. Are you someone who is willing to be one of those first in line to take the vaccine if it's offered to you?
Absolutely. I have researched the trials. I've talked to a lot of people about the trials. I've reviewed a lot of the side effect data, and a 95% efficacy with the Pfizer and the Moderna vaccines is extremely powerful. And when you look through, even some of the methodology behind it with the messenger RNA and the fact that, you really can't get the virus from the vaccine, how the messenger RNA virus works, it's pretty reassuring. Side effects do happen, but side effects happen with a lot of vaccines, and the side effects are generally pretty mild to moderate, generally short-lived, and generally, encompass typical side effects with fatigue, malaise, type, soreness around the injection site, sometimes redness, joint aches, muscle aches, sometimes headaches, sometimes fevers. But overall, the side effect profile is very acceptable.
You've also recently been named by Miami-Dade County Mayor Danielle Levine-Cava as the county's first chief medical officer. My understanding is this is a position you will do in addition to the work that you're doing at Jackson. It's sort of an advisory position. Can you sort of explain to me a little bit better what you see your role is, or is it still being defined?
Yeah, it is on top of what I'm currently doing at Jackson. I don't anticipate my responsibilities at Jackson changing at all with this role. It is very much a medical advisor role for the mayor and her team. And I think it will continue to define itself as we go forward. Initially right now, obviously a big focus is the pandemic and the response from the county and how we can try to minimize community transmission and reinforce a lot of the protective actions that we're trying to push throughout the communities. But we anticipate it changing, as we get further and further along with this pandemic, and the pandemic to some extent gets behind us. There'll be other issues that come up, that face the county that I'll be called upon to help, advise, and make recommendations to the mayor and her team as to the best way to manage some of these issues. I think the other important thing to realize is that I am also kind of a conduit. I have access to a lot of unbelievable resources here between Jackson and the University of Miami. And so I have content experts in a lot of different areas that are also very supportive and willing to help. And so I think that that's another big piece of this, is that it's not just me, it's the connectivity with, the public health system and the academic center at the university.
How would you grade, or how would you evaluate how Miami-Dade has done over the last 9 months? Should they have been more aggressive in terms of shutting down sooner? What lessons, I guess that's maybe a better way to phrase it. What lessons have you learned, in terms of how we deal with businesses, the issue of masks, and everything that comes with it?
Obviously this was something new that all of us faced, this year. It's kind of we hope it's a once in a lifetime issue that we're all going to be dealing with during our lifetimes. I think we constantly learn. We're still learning about opportunities to do things to better our management of the pandemic. When we talk about some of the basic measures, I think those have been consistently promulgated throughout the communities. Masking, social distancing, trying to avoid large gatherings, groups, celebrations, hand hygiene, watching for symptoms, getting tested, quarantining, contact tracing. Those have all been consistent staples. I think one of our big challenges has been, compliance. We try to get all of our communities and all of our business owners and a lot of different people who are tightly involved in the communities to support these efforts. And the more we do that, the more we're going to reduce community transmission and help decrease the positivity rates that we see across the county.
Does it make it more difficult when either the current president or the governor sort of undermine some of those efforts by not allowing more stringent enforcement among local municipalities?
Yeah, I think there's a lot of factors that have to be considered in those kind of decisions. I'm not really on the political side. I'm much more on the healthcare and medical side. So I look at this very objectively from our health system and from the practice of medicine. We do a lot of stuff. I think that the health systems across South Florida have done an amazing job to deal with this pandemic and to try to create as safe an environment as possible for the members of our communities.
Let me ask you this, as we're heading into this holiday, what is your message to the public?
So it's really coming back to the basic elements of the recommendations that we've all talked about. People need to be very conscientious about wearing their face mask at all times outside of their immediate household. people need to socially distance. 6 feet's the recommendation. We need to try to, especially over the holiday season, avoid large gatherings, celebrations. It's very difficult, when typical holiday seasons, we want to spend them with family, friends, coworkers, whomever else. We have to be more conscientious about that this year as we get through this stretch of holidays in the setting of this pandemic. The other thing I would say, hand hygiene is always important. Be cognizant of what's around you, how close you are to people not wearing masks, and really try to spread the message. This is an effort to try to minimize the transmission among community members. That's our responsibility. And if you own a business and you have people in your place of business, be responsible for what they do and how they behave and how they socially distance.
No, it's remarkable. We're so close with the vaccine, just from widespread use of the vaccine, just months away to I think of those who die in a war on the day that the armistice or the peace is signed. It almost feels like that as we head into this holiday season. You don't really want to be that last person that dies an ignoble death when the cure is right there or the vaccine is right there to save so many.
It's a great point. The really tough thing about this virus is its unpredictability. We see it hit people, with no obvious risk factors, and it's just an aggressive illness. When you look at the great majority of people, it's no symptoms to mild symptoms. And how it distinguishes between one person to another and causes such a ravaging illness in one and very minor symptoms in another, very difficult to anticipate. So that just adds to the pressure, I think, on us to appropriately respond to the opportunities to get vaccinated. And you're right. I think that this is the beginning of the light at the end of the tunnel. We need to keep moving in this direction to get to a better place.
But there's still just a little bit more tunnel to go.
There is. We're not breathing a sigh of relief yet, but, we're optimistic, at least, that now we have this to look forward to.
We'll be right back with the newest Miami-Dade County Commissioner, Danielle Cohen-Higgins.